Hello and welcome to Wilson Center Now, a production of the Woodrow Wilson International Center for Scholars. I'm John Molesky. Today we focus on the Wilson Center's award-winning publication, the Wilson Quaterly. And one of the guests joining us is its editor, Richard Byrne. Hi, Richard.
Hello.
We're also joined by three contributors to the current issue. They are Rui Zhong, a program associate with the Wilson Center's Kissinger Institute, Alex Long, a program associate with the Wilson Center's Science and Technology Innovation Program, and Joe Dresen, a senior program associate with the Wilson Center's Kennan Institute. And we'll hear about their contributions to the magazine in just a moment. But first, we begin with the editor. Richard, tell us about the focus of the WQ spring issue.
Well, we've been planning this issue for the last 8 months, and we wanted to have a comprehensive look at the title of the issue is Public Health in a Time of Pandemic, and bring together a lot of the strands of what we do here at the Wilson Center, particularly our strong regional expertise, to see how countries, nations, regions were coping with the COVID-19 pandemic. And, you know, we do that at Wilson Quaterly through analysis, reportage, and for this issue we also incorporated 6 first-person accounts from various places in the United States about where people talked about how they coped with a long COVID winter, either people on the front lines or people who were covering the pandemic.
And you did a couple of those yourself, right?
I did indeed. My 2 interviews are one with Chris Hayes, the host of MSNBC's All In with Chris Hayes, and the second was with a very Twitter visible epidemiologist named Saskia Popescu, who's become really one of the go-to voices on that platform about a U.S. response. So there's, and I think the entire series turned out to be a highly successful way. You know, at the Quarterly, you know, we can be blown out of the water by breaking news, right? And these 6 interviews were really a chance to trace a trajectory of experience during some of the darkest moments of the pandemic in the United States.
And you see a lot of the themes that emerge. There's some universality to it. People are dealing across the country with a lot of the same issues.
They are, but also very specifically in their own responses. You know, I think a lot of people would like to say that the pandemic is an individual experience and a collective experience, and you have to kind of, when you're talking about public health, you can't lose sight of either one of those, because every individual has experienced this in a very personal way, but we've had like a strong collective failure and success in response.
A little peek behind the scenes, Richard, you know, the sausage making, given the scope and the nature of this issue, how difficult is this edition of the WQ compared to others that you've worked on?
Well, I do think we wanted to take advantage of the fact that we have a web platform, a digital platform, so we could expand our scope a bit from a normal issue. I mean, this issue had roughly double the number of stories that we would usually do in a WQ, and we were able to, you know, we were able to call upon a lot of great voices at Wilson, but also a lot of independent scholars to, you know, to weigh in and give us a real chance to talk about. It's such a huge topic. We were able to talk about a lot of issues in this edition of the Quarterly.
Yeah, it's really a spectacular piece of work. Congratulations on an amazing issue.
I had help.
Well, and we're going to talk to some of those people who provided that help in just that. So for our viewers, what we're going to do is we're not going to give you the whole, you know, cliff notes. You have to read the issue yourself, but we will tease out some of the things that the 3 authors who are with us have talked about. We're going to begin with Rui. Rui, and the title of your article is Parallel Narratives, and you're talking about narratives in the US and narratives in China. Explain to us the construct and what you were trying to express.
Okay, so I started tracking COVID-related issues and policy narratives last year in 2020, when we had some of the earliest cases pop up in my hometown of Wuhan. So even that early on into 2020, it became very apparent that memory, record keeping, and especially policy record keeping was a very, very malleable thing. Because China had a lot of discretion on what they could include or exclude from the narratives, we saw that as COVID numbers were more under control, that the political story of COVID tightened. In the United States, we also see the idea of policy memory, but here I think the issue really becomes the problem of short-term memory. So we've seen a lot of states in the United States, have case numbers go up, proceed to reopen or relax mask rules, and then have spikes and hospitalizations rise again. And so the politics of COVID in China, the United States, now India, and other places in the world, Canada is also experiencing a really big spike. A lot of the politics, national and sub-national, have been, incredibly self-serving and often more about the political gains than the public health goods that can be provided.
It's a little bit heaping of humility for people from the United States who view China as a totalitarian type state that is going to control the message from the central government. But you give examples of similar type activity only farmed out to the states in the United States.
Right. In the United States, some of this type of information repression isn't even governmental. We've had meat packing plants, we've had warehouses for large retailers like Amazon really try to discourage workers from reporting mask and PPE shortages or insufficient social distancing. And when you see the information bear out, it's people working in warehouses, factories that are getting hit with cluster outbreaks. And it's even as, vaccination numbers in the United States are going up, this is not something that gets undone easily.
Ray, you termed this parallel narrative, the parallel narratives, as political amnesia. And I'm wondering if you could just talk a little bit about the difference in technique. In China, there's a more of an exclusive and a suppressive mode. And in the United States, it's what was famously known as flooding the zone. There's too much information and crucial facts get lost.
Absolutely. So China has this very centralized system. Their media is managed very much from a top-bottom sort of direction. You have central internet regulators, and of course you have the political security of China's central government being protected, which was the case as the pandemic went on and the situation stabilized further. That's not necessarily the case in the United States. We can have, media report freely, conduct certain types of investigations. However, the problem with sort of memory in the United States is that, media can also have its sort of institutional memory problems. There was a lot of mixed messaging on, when you should wear a mask. Now that we're getting vaccinated, how mask standards are getting relaxed. There's even the issue of thinking, well, when is the pandemic over? Because even though we're starting to see vaccination rates in the United States go up faster, there are a lot of communities in the United States, including large municipalities like New York, that have minority communities still going under vaccinated. And so when I say political amnesia in the context of, flooded information, it's that it's very hard to really organize all of the events happening in the context of such a wide-ranging pandemic and its problems.
Richard, tell us about the section that Joe contributed to, where you have a sort of a survey of the world.
Yeah, we wanted to bring together, because Wilson, and especially if you go to our homepage, you'll see we have a dedicated page to the COVID-19, and our programs have been so incredibly diligent and intensive about tracking response throughout the world. And I really wanted to basically give the center a showcase to bring a lot of those strands together. So with our partners at Marquee, who help us publish the Wilson Quaterly, we were able to, pull together some fascinating aspects of global response, and many of them that haven't been really written about at length. And one of and Joe's contribution in particular was really fascinating, because again, I don't think we have a great understanding a lot of times about Russia and its neighborhood and its response to COVID.
And Joe, tell us a bit about that. I'm wondering, as you were listening to Ray talk about parallels between the US and China, were you imagining any parallels about Russia?
You're absolutely right about that. And Russia does have a parallel with China. Russia is a far better parallel with the United States in terms of vaccine hesitancy, in terms of flooding the zone, but flooding the zone with disinformation and misinformation. And the results are sort of very tangible in Russia. For example, they have a vaccination rate that's under 10% of their country. Their vaccination rate is something like 300,000 a day right now. That'll get to the next 10% of the population in about 100 days. And it also sort of echoes the political issues at the forefront. For example, very much like the Trump administration, Putin wants COVID to be on the back burner and out of mind. So one of the manifestations of that, for example, is the underreporting of COVID deaths in Russia, and that translates into a situation where you have what's called a undercount coefficient. These are measured across nations, and usually they're somewhere around between 1% and 2%. So yeah, you take a number of reported COVID deaths, you multiply that by the coefficient, you get the actual deaths, and that's found by figuring out what the excess mortality is from year to year. So if if the United States is 1.3%, Russia's number is 6.5. So they have over 400,000 deaths related to COVID, and that's with the population in less than half of the United States.
Is there any lesson to be learned here that could actually change the nature of the beast if there's another pandemic? Do you see Russia changing anything based on the outcome? Or is this going to be like Groundhog Day where lather, rinse, repeat?
So it really depends on what the motivation is with addressing the COVID situation. In my estimation, the primary motivation is to maintain, for Russia, is to maintain state security. And by state security, I mean the security of those actually leading the state. So they're not actually having as their first priority protecting the Russian population. They have it as keeping the state stable so that there's no political dissent that translates into street protests. So one result is the underreporting of COVID deaths. Another report is people distrust vaccines in Russia to a great extent. 75% of young people don't trust the vaccine, for example. And the sort of the other side of that coin is that the state wants to use its response to demonstrate state capacity. So they named their vaccine, their very effective vaccine, Sputnik 5. Sputnik to evoke the Sputnik satellite, the triumph of Russian technology in space. And the V is not V for 5, it's V for victory. So it's V for victory to evoke the shared victory of the Soviet Union, Soviet Russia, with other nations in World War II. Well, Russia wants to be a world leader, and they wanted to use this vaccine to promote that symbolism of them being in the forefront of world leaders. But their vaccine diplomacy, while probably saving many, many lives, is not quite having the political soft power benefit that perhaps Putin might have wanted or expected.
Yeah, the Sputnik 5, the power of myth, right? Tapping into modern mythology. Alex, I purposely decided to come to you last because all roads lead to science, or at least you think they should. And one of the pieces you wrote, the title, The War Over Science. Are you surprised at how much throughout this pandemic politics has trumped science?
No, because of the political state that we were in as a country. So I think that we talked about this on the Wilson Now back, oh my gosh, like in February.
The early days of the pandemic, yeah.
Truly, about how this was going to be a struggle, because the political space that we were in was one of like parallel narratives of, one built on some truths, but mostly falsehoods being led by, disinformation and certain media organizations, and then the other one trying to push back on that. So we already knew that going into this. And once you already set up two structures of like basically alternative facts and the facts, science deteriorates just there. And we saw that in the very early days and moving forward. So I think when the pandemic finally came over to America and the United States, it was almost inevitable what happened, though avoidable, because of the things that we had in place prior that were just not used.
So I'm sorry, go ahead, Richard.
Oh no, Alex, I'm curious. So one of the things that you touch upon in the piece is this sense that the normal back and forth of science, right, is somehow on massive public display, and there's a tendency in a public that doesn't always understand the processes of science to delegitimize or raise doubts about it. And I wonder if you could talk a little bit more about, science on Twitter in particular.
Yeah, I think that we got a real crash course in the scientific method as a public, one that we were unprepared for based on how we actually view politics and political leaders and what they say. Because with politicians, if you see them say one thing one day and another thing the next day, that's called flip-flopping, and that's inconsistency. Within science, that's a part of the scientific method. And it's not necessarily changing an opinion or changing your mind. It's reassessing based on new facts.
Yep.
So what happened is we were having to reassess based on new facts, but because they were coming out of the mouth of a political leader, it seemed political. It seemed like a switch. And I mean, this was used obviously as almost a weapon for some to say, oh, now they're saying that we need to wear masks. And yes, there is blame to be laid at the feet of certain scientific organizations like the CDC on their advisement about masks and how transparent that process was. But once it was clear that masks were a net positive for the pandemic, and now one of the, I would argue, like best technologies, save for the vaccines, to like save us from ultimate like demise and destruction that was forecasted back in April. Once that was then apparent, flipping made it seem like it was a political move, made it seem like, oh, now we're like changing our minds and we're withholding things, when in reality, the science community is just trying to get the public the facts as quickly as they can, while understanding that the scientific method works and has stopgaps and has referees already in place so that they don't say anything prematurely or hurt anyone in the process. And again, there's something to be said for maybe in the future, we need to talk about how conservative scientific guidance is. But on the large, the conservativeship of scientific guidance and making sure that they know what they need before they say it, rather than, putting the cart before the horse, is like important.
A strength of science, the ability to change your mind based on data and new information, is a complete weakness when you put it into the political arena, where certainty seems to sell, independent often of facts. Richard, I think this is a theme that goes larger than this current issue and even larger than the pandemic. This is an ongoing struggle for a publication like the Wilson Quaterly, for an institution like the Wilson Center, who's attempting, as Alex describes, to apply a certain version of the scientific method where you're moved by evidence versus you just come in with a pre-cooked conclusion and you don't budge from it. Is this something that you're acutely aware of as you're assembling issues, working with authors, thinking about themes?
Absolutely, because the history of the Wilson Quarterly itself is about a diversity of well-argued opinion, not punditry, and also a well-argued opinion that is buttressed with real reporting, factual analysis, and the sorts of things that we were able to do in pulling together the interactive feature for this issue about global response. This is not the same pandemic everywhere, and it's very important to be able to not only expose readers to those distinctions, but to give them as much factual basis for examining our own response, using that as a yardstick.
Alex, do scientists need more media training?
That's a great question. And I mean, there's a whole discipline that has come out in the recent years with the proliferation of Twitter and other things, called like science communications, #SciComm. Many of you are probably very familiar with it. And like Richard brought up earlier with the people on Twitter that I didn't get to touch on, but I will now. We saw in the US, because there was this absolute void in reliable scientific evidence coming from the White House press briefing room, scientists realized that it was kind of incumbent on them, at least in the US, to start informing the public through these kind of boundary means, one of them being Twitter, and then also, through regular media outlets. But there's something to be said for, I mean, those people, I can think of a couple different like avatars on Twitter right now and names that I didn't know before, or many people didn't know before, that now they know like the back of their hand. They hear them on NPR, in the New York Times, Ashish Jha, like those type of names. And that basically fortified our scientific understanding during the pandemic. So those science communicators who have taken it upon themselves to herald all of the facts that they have seen through different research papers and preprints and be able to give them to the public in manageable doses was a huge filling in the absolutely broken science policy pipeline that we saw kind of play out for us throughout 2020.
Ray, I want to ask you the question about China that I asked Joe earlier about Russia, which is, are there lessons learned here? Would the Chinese government handle an outbreak differently if this were to happen again?
Well, I can't say what the specific plans of the Chinese government are in terms of public health, but I think there's a lot of work specifically in the US-China relationship that necessitates rebuilding certain channels of health information, communication, and data sharing between non-governmental actors has been pretty robust throughout this whole process, but governmental communication and trust has, I think, really diminished. There were theories of the virus being a lab leak that have not been conclusive yet. And in terms of Chinese state media, there's been a lot of conspiracy theories over whether the United States brought COVID to China through military exercises. So you have these sort of unfounded theories sort of spreading, and it hasn't done much in terms of health diplomacy. That being said,
no, please go ahead, finish.
That being said, I also want to follow up on your point earlier about, science and politics. Sometimes you can't untangle the two. India right now is experiencing one of the worst spikes we've seen. And some of the problems that it's experiencing is in part due to its struggles to get enough doses of the vaccines based on certain types of patents. You can't really take the politics out of certain types of issues. And I think that's one of the political problems that we're going to be continuing to work through in the longer term.
Well, I want to thank all of you. And, you know, I consume tons of information. And I have to say, Wilson Quaterly is at the top of the list of value, pound for pound, letter for letter, word for word. You can learn so much. It's so well done. Thank you for sharing your contributions with us today. I encourage people to read it. And before we close, Richard, if you would tell viewers how they can both read the Wilson Quaterly and subscribe to it if they so choose.
So we are at wilsonquaterly.com. We're a free publication. We don't have a paywall. And if you go onto our website, at that hamburger menu at the top left, you can click on that and it says, it points you to a subscription. And our subscriptions are free as well. And if you do subscribe, you get the quarterly directly into your mailbox the 4 times we publish every year. And you also get a monthly dispatch now of things that we're reading, updates on authors, and just all sorts of really useful information to keep you connected to the quarterly in the months we don't publish.
Terrific. And I'm not shilling for the company. I mean every word of what I say when I applaud the terrific work of the WQ. And Richard mentioned that this was a larger issue than usual, so our coverage of the issue will be larger than usual. We'll be back next week. Richard will join us when our guest will be John Barry, the author of a book called The Great Influenza, who has a piece in the issue titled Pandemics Then and Now. Before that, or until then, we hope you enjoyed this edition. I want to thank Joe and Alex and Ray for joining us today, and Richard as usual, and hope you'll join us again soon. Until then, for all of us at the center, I'm John Molesky. Thanks for being here.